Gail Arno is the Director of Care Management for Elder Care Management. She began her career in aging services in 1998, serving as a family consultant for a local placement agency. She actively educated and guided a generation of seniors and their families to resources and information available throughout the greater Sacramento region. In 2010, she brought her experience and expertise to the team at Elder Care Management, providing service and oversight in the growing field of geriatric care management. In 2020, Gail assumed the role of Director of Care Management for ECM, leading the exceptional team of established care managers. Gail received a Bachelor of Science in History from UCLA and a Bachelor of Science in Psychology from CSU Northridge. She also completed a graduate certification program in gerontology through CSU Sacramento, where she concurrently completed a 6-class case management course certification. She is a California Residential Care Facilities for the Elderly, or RCFE, certified administrator, and is a state-approved instructor for RCFE administrators certification courses. Additionally, she's a volunteer for the Alzheimer's Association and a board member for Del Oro Caregiver Resource Center. Gail is a certified care manager through the National Academy of Certified Care Managers and a member of the Aging Life Care Association, or ALCA. Gail offers invaluable wisdom on the subject of aging. And with that, I will pass it over to Gail to share Successful Aging, It Takes a Plan. Gail?
Thank you so much, Maureen. Appreciate the introduction and all the details too of how to manage through this next hour that we'll spend together. And I also want to thank everyone for joining us today. This is one of my most favorite presentations. It's logical. It gives you lots of tidbits. Hopefully for many of you, you'll be able to check all these boxes off and say, yep, I've done that. Yep, I've done that. Or no, boy, I'm going to jump on that. I'm so glad I got a little bit of a boost to get that taken care of. So again, I really appreciate the opportunity to share with you what we feel we've gathered as a really sensible approach to aging. And I love that we take it under the genre of successful aging, because I think that's what everybody is hoping for. Doesn't always happen that way at every turn, but we'll talk a little bit about how to make those adjustments and regroup as well when things aren't going maybe as successfully as you had hoped in that aging journey. So without further ado, we'll carry on, and I look forward to sharing this information with you, and hopefully we'll have some questions and some good dialogue at the end of the presentation. So again, my thanks to you all for joining us today. So we're going to talk a little bit about just all of the things that are critical in getting the documents, getting the plan in order, as it might be. And we strongly believe that there should be plan A, plan B, plan C, even that you should have an opportunity to really look at everything that you can possibly look at from every angle. I would be really good if I had a crystal ball and I could tell you each what you're going to face as you go through this aging process. But I don't even know what I'm going to face. So we're good, but we're not that good. So in the interim or meantime, we've kind of outlined some ideas and thoughts and giving you some resources to get that process moving. So we're going to talk about your legal documents, what is really necessary and what's beneficial, what each document really generally means. We're not lawyers, not attorneys, but we know enough to refer you to those resources as it might be. I'm going to talk about the reality of the financial issues as we face them. Boy, in the 25 years I've been doing this, I can't tell you the number of times that I've had so many clients and family members say to me, doesn't Medicare pay for this? Or my neighbor gets this all free. How come I don't get this free? So I'm going to be honest with you on the financial perspective of what it costs to age and get services to support you in that aging journey. I'm going to really encourage everyone to keep their health in the best check that they can. Not missing checkups, keeping your mental health in good place, your emotional health in good place, and your physical health in good placement is going to be important to the whole picture of things as you age. We're going to talk about what's covered and what's not, and who does pay for what and why. We're going to help you create a toolbox, some ideas, some options, some things to have in your toolbox. And I like nothing more than to give you all this information. Hopefully you tuck it all away and you don't need to refer back to it for years and years down the road. That may not be the case, but as long as you have it in place, you can refer to it. You have a general knowledge of what these entities are and who services what and how things are accomplished, so that you're not trying to navigate all of that when you're in the middle of a crisis. And that's the biggest concern that we want to avoid. We're going to talk a little bit about that thing, a little inconvenience called COVID-19, and what impacts it continues to have on all of us today, particularly in this scenario, of aging successfully. And then we want to talk to you about end of life conversations as well. I strongly believe that this is the gift you give your family, is letting them know what it is you wish and what you want. You don't have to spend a perseveration on this topic, but we do need to tell one another what our wishes are. Again, tuck that information away and we'll refer to it when it's necessary. Again, typically when it's necessary, it's a crisis and we're emotional. So better to get that out of the way now, tucked away, and ready to discuss when the time comes. So these are just a few of the tidbits we're gonna dive into today. So this is one of my favorite quotes, and we thank good old long gone Theodore Roosevelt for this one, but true enough, old age is like everything else. To make a success of it, you must start young. And we are. The minute we're born, we are aging. No doubt about that. But I think the other side of that coin is the minute we're born, we are striving for independence. And so, those first steps and holding the bottle and off to the school and picking colleges and picking mates or partners, etc. We're always striving for that next step and that independence. And then there comes a time in all of our lives, some more sooner than others, some more than others, where the system and our needs speak to dependence. And that is a very tough switch. It is very difficult to wrap our hands around it. If we do our planning in advance and those needs, wants, and wishes are articulated, then I think we have really done ourselves a good service, and those that we love who might end up being our decision makers a good service. So again, to make a success of it, you have to start young, and part of that is planning. So the importance of a plan, it's critical. And again, as I mentioned, I don't have knowledge of, nor do I have control of anyone's aging process. But one thing we can control in our aging process is making that effort to make plans and making plans for contingencies, multiple contingencies. I find it almost nearly amazing when I talk with a family that appears very wise and very cohesive, and they haven't talked about it. I don't know what my dad wants. He doesn't like to talk about that. Or even a spouse or a partner saying, I don't know, we never spoke of that. We didn't really make those plans. And again, as this slide shares with you, most of the clients that we work with come to us in the midst of a crisis. And so their decision-making abilities are just so difficult. They're not in the best frame of mind. It is not the time to be researching when you're in the middle of the crisis. It's the time to implement when you're in the middle of the crisis. So having a plan can quell the crisis from whatever might happen. I don't think it's going to stymie it altogether. I don't think it's going to get rid of it altogether, but I do think it's going to help us make better decisions. And it's a gift we give to those we love. And if you can look at it from that angle, I think it's a whole lot easier to schedule, to plan, to make some choices. And we'll walk that journey with you. We're always happy to help plan. Plans are our goals, definitely. It's really an important thing for us. Okay, next good thought, hopefully for everybody, is to get your legal matters in order. It is so important to have those legal plans, those legal documents in order. Sometimes our confusion is so great that we can't actually enact legal documents. So it is better to get those things in place. Changes can be made down the road, but they are definitely much more beneficial if they're in place and they're articulated. You can even tuck them securely away somewhere safe, but really important to get them in place before the crisis does loom. So what are those legal documents? Well, certainly you want to designate a power of attorney for finances and a power of attorney for health care. These can be one and the same. They can be different individuals, and I'll share with you in my own family as an example. I have a almost half a baseball team of brothers, 5 total kids in our family, 4 boys and myself, and we decided that one of my siblings is really good with money and really gets the financial end. We just picked him, and he was the financial power of attorney as a backup to my parents. And then my brothers turned to me because I appeared to be in the healthcare industry, a little sideways, but in the healthcare industry, and said, well, let's put Gail in charge of the advanced healthcare as it might be, because she has a sense of medical decisions. Again, that can be changed at any given time, but that power of attorney, it isn't a decision maker per se, but it is someone who would be afforded insight and information into your current circumstances. So very important to designate a power of attorney, both from finance and or for healthcare. And again, they can be one and the same. Another document that's really quite important is your advanced healthcare directive. This is a planning document that you will work out with your attorney as you develop your trust and or your will, your living trust or your will. And it is a good 6-7 page document that will allow you to really make known what your wishes are. You know, should this happen, this is what I would like to happen for me. Should this turn occur, this is what I'd like to have happen for me. We've seen advanced healthcare directives that have said, I'd like to stay in my home as long as possible, but I do not want all of my funds utilized in that capacity. We've seen a number of different directives listed in this overall advanced healthcare directive. It is a critical, valuable document. Again, it is really deemed more of a planning document. It's developed by an attorney, but it should be, a copy of it should be in your medical delivery system, be that Mercy, be that Kaiser, be that Davis, whomever your delivery system might be. The additional document that we are extraordinarily fond of and feel very certain of is the need for a POLST, or you can see there the actual name of that is the Physician's Orders for Life-Sustaining Treatment. This document is actually an action document, and it is a physician's order. So it is completed. It's a 2-page document, and our next slide shows you a good example of one. It is a document that the doctor and the patient fill out together. It has its basis in the wishes and wants that were created in the Advanced Healthcare Directive. It is a concise document that is, again, also should be part of your medical delivery system, but it also should be at your home, wherever your home might be, in a non-conspicuous location, so that anyone who were to come into your home and deliver some emergency medical care would have the POLST to refer to. It is succinct and to the point, and it allows them to take direction based on doctor's orders to provide whatever treatment you have designated for them to pursue. It's a really important document, relatively new within the last decade. I'm surprised at the number of individuals who are aware of this document, but I'm even more surprised at the number of individuals who are not aware of this document. So I do think this is an invaluable document to have in place. I can guarantee you that an emergency response personnel, EMT, 911, if they come into the home to assist you based on a call for emergency, they are not going to take the time to read through an advanced healthcare directive, which can be 6-7 pages in duration, and try to ascertain what your wishes and wants might be. What they will do is go directly looking for that post, and a good visual location, typically the kitchen, typically the refrigerator, is where they go to and look to get some direction on what kind of medical care they should provide. If they arrive and there is no direction on medical care, they are obligated to provide life-sustaining treatment. They will do what they are charged to do, and that is every measure to keep you alive as it might be. And then you have your trust and or living will, living trust. You might want to take a peek and talk to attorneys as to whether you should set up something like that. And you'll get different opinions. All of these documents are worthy of a review periodically to make sure that they reflect your current wishes and they reflect the current individuals that you want in a certain power of position or position of power, excuse me, power of attorney, again, finance or healthcare. So really encourage getting that legal house in order. Step one, and doable, manageable, almost a checklist of things to do. So here you can see two things that we think are really invaluable to have again in the home. On our left here is the physician orders for life-sustaining treatment. This is the post. It is bright pink in color, gets everybody's attention, doesn't it? Easy to find, shouldn't be tucked away in your locked file cabinet at home. It doesn't do anybody any good there. It should be on the refrigerator in the kitchen somewhere, and a copy of it again should be with your medical delivery system and with your power of attorney for medical decisions in case they are drawn into assisting with making some decisions and speaking for you because you're unable to speak for yourself. The other thing we have here is just a medication log. It's very, very beneficial as well for those emergency response individuals. We tend to encourage our clients to have their pulse and the medication log right behind it on the refrigerator. You can see it gives the names of the current medications, the dosages you take, etc. This is really helpful when you land at the hospital and they are trying to figure out what are you on and what have you taken recently. This is a good tool that will help them make a better decision on their care that they're providing for you. Both of these invaluable, pretty simple to keep up, and should be reviewed frequently as it might be, just to make sure that they're accurate, particularly that medication log, because it will entail maybe some changes, because as we well know, medications change from time to time. Next thing you want to consider is, what does this look like? What are your finances like? Do you have a financial advisor, somebody who has been working with you, or do you need an individual who can help you plan for your financial future? Make sure that your power of attorney for finance is aware of who your financial advisor might be, and make sure that they're prepared to step in if you're not able to handle your finances any longer. So it's important to make sure that you have that financial advisor and that you discuss what your wishes and wants are with that financial or durable power of attorney. Again, I see so many individuals who will say, I had no idea I was the power of attorney. I hadn't had a conversation with them. I don't know what their wishes were. They never shared that with me. Again, I think it's a really great gift to let our families know what our wishes are, but also really important to sit down and have an earnest conversation with whomever you have appointed in that position of power of attorney. And then also a good conversation with your trusted financial advisor, making sure that everybody knows what your wishes are in regards to your choices as you go down the line here and in the aging process. And then a good understanding of what things cost and who truly pays for what as we age. A good, and we can talk about that, and we will in future slides. We'll kind of go over it very briefly, but very worthwhile to have a conversation with someone about what costs are today. And I think, as we all know, whatever the costs are today, we can be assured that they're likely not going to go down. They're probably going to go in that upward motion, unfortunately. So we want to make sure that if we can't handle it today, we certainly won't be able to handle it in the future. And then what are our choices from that point on? So again, equally important to understand who pays for what and what things cost. And that's a little bit of homework that you can do to be successfully aging in place, as it might be. Here's our little bit of information. Again, I won't belabor this too heavily, but you can see the different categories, the different services. These are some average costs in our Sacramento area for some of these different services, starting with the nursing home option. And it's really important that you have an understanding of what the nursing home provides, what it costs. Yes, many of us might have a turn in a nursing home for a rehabilitative stay, and that's good. Medicare is a big part of covering much of that. But if we have a medical need and we have to stay in that nursing home, you can see the costs are very astronomical per month to stay in that environment. The assisted living settings, the next step down from medical perspective and care perspective, is the assisted living, both large and small. You can see that, again, an average cost per month is about $5,400 a month for a private one-bedroom place. We will see that average rate go up and up and up, and I've seen it in the 25 years I've been doing this, and it continues to go and nowhere else but up at this stage. We also have the option of maybe bringing in someone to care for our loved one or ourselves at home. This is not a service that Medicare covers or Medi-Cal, so it's really important that you understand that this is all private pay. And you can see the example we have here. If you were to have someone come into the home 4 hours a day, 7 days a week at $30 an hour, and that may be low at this point. I think in 2021, we've gone up a little bit. That alone for 4 hours a day is $3,750. And that there are 20 other days, 20 other hours in the day. So, only 4 hours of coverage is going to run you about $3,800 a month. Pretty pricey. To be honest, if I were to price that out to a 24/7 round the clock experience, we're looking at $22,000 to $25,000 a month to have someone come 24/7 into your home and assist you in that regard. Pretty pricey, and not too many of our clients can afford that. We also have a lovely idea, a lovely option with the adult day programs. These are day programs where individuals can go and spend some hours during the day, get perhaps a meal, get some socialization, some activities, etc. Really wonderful option. But again, private pay. You may find a few that are covered through Medi-Cal, but there are some significant financial criteria to be met there. They run about $89 a day, and you can see the example here. If you use 21 days a month, no weekends, of course, that would run you about $1,900. So all of these are coming from Genworth, these price points, etc. And there are a couple other things that Genworth has really nicely highlighted for us. A perfect example, 7 out of 10 people over the age of 65 will at some point in their life need some long-term care support. So you may be sitting there thinking, oh gosh, this isn't going to be me. I'll have no problem. I don't need this. you might be that one of those 3 individuals from the 7 of 10, but for the most part, we find after the age of 65, there is a need for some long-term care support. And Genworth again states that 44% of the adults under age 60 have discussed any long-term care or retirement issues with their adult children or with their parents, etc. So we need to have these conversations. I think that's really important. And again, there's a projection that inflation is going to really escalate these costs and be a worry, certainly in the long run. So really encourage you to have these discussions, know what the costs are, know what you're up against so you can plan accordingly and be wise with your plans as it might be. I think it's really important that you have a health check, making sure that you're in good shape, maybe you're in not only your loved one that you may be attending to, but that you are also in good shape. You are no good to anybody if you are not taking care of yourself as well. So equally important in this dynamic is particularly for both partners in any relationship that might be covered with caregiving, etc. So establish a good working relationship with your healthcare provider. Make sure they're communicating with you and that you feel you can communicate with them and that they're listening to you and providing you with the support you need. I'll be honest and tell you, my father was just notorious. He would go to a doctor's appointment. He'd have a very precise list of questions, etc. And the doctor would be at times dismissive and you're fine, you'll be fine. And he would get half his questions answered. He'd walk out and say, oh, I don't really care for that gentleman. And we would, or that person, and we would say, Dad, we could switch. Oh, no, I'm lined up with him. I better stick with him. In this day and age, let's make sure we've got a good, cohesive, two-way street as we work with our healthcare providers. There's a lot of providers out there. We have some choice in this matter. Attend those regular health checkups and those procedures. Little things can loom and then they become large things. So get the colonoscopies, get the eyes checked, get the ears checked. Be mindful of all parts of our body and get those checkups taken care of and get those simple procedures done before they become major procedures. We love the thought of always bringing an advocate to your appointment. It's very nice to have a second set of ears to really understand and know exactly what's being said, what's being shared. I have heard different things than my clients have heard. I've heard different things than my family members have heard. So it's always really nice to have two sets of ears, really nice to talk about the appointment afterwards with the one that you're advocating for and with. So that, did you hear it? I thought I heard this. Did you hear that, etc. So an advocate and a second set of ears is a really good thing to bring to any appointment that might have some medical tone to it. Again, keep that medication list as updated as possible. As with each doctor's appointment, you'll want that medication list to be available, updated, and accurate. It takes a little time, a little energy, but we provide you a form. We're happy to get that to you. You can create your own, but really important to keep that updated, most definitely. Your teeth are important. Infections in the mouth and in the teeth with the teeth can affect the entire bloodstream. So keep those teeth good and healthy. Your eyes are important. I hate to see someone lose their eyesight because they just weren't able to get to the doctor to take care of something that could have been mitigated and minimized as it might be. Check the hearing. I know we're all waiting to hear that maybe Medicare down the road, probably not soon, but maybe in the near future, will cover those hearing aids as it might be. But you can be misinterpreted as being not as cognitively sharp as you'd like to be interpreted because you couldn't hear the questions as they're coming at you. So your hearing is so very important to you as well. And of course, the health of your brain matters oh so much. Be reminded that long-term untreated depression can lend itself ultimately in the long run to dementia. Good spirit of the brain, good spirit of the soul, very important. make sure that the brain is taken care of, eating well, exercising well, and taking care of that good health check. Really critical and important to your overall well-being. Don't neglect that brain health. Keep that mind happy, or excuse me, keep that mind and body active and happy. Investigate anything that you think is changing for you. If you're just feeling foggier than you have, or you're recognizing that the one you're charged with for caring for is struggling, investigate those changes. We have, dementias and Alzheimer's diseases just leading the parade in regards to diagnoses for our seniors in this nation and in this world. So really important to get those minor concerns addressed and checked. And then consulting the professionals. Many times I'll find that families will ask me, well, we know mom's a little bit confused. The primary doctor already told her she's a little confused. Why would we need someone to further tell us? Really important to have the neurologist look at the brain, the cardiologist look at the heart, the urologist look at the urine concerns. I know we're a very specialist geared world, but that is the reality, and we want to make sure that we're seeing the professionals that really attend to the concerns if there is any health or brain neglect, as it might be. Be reminded too, our mental health is as important as our brain health. We all know that the statistics show us that social isolation and depression is not good for anyone, certainly not good for a senior, and yet it's sometimes what they get is a steady diet. So making sure that there is interaction with others, doesn't have to be tremendous, but periodic interaction with others, family support, other seniors. This is where senior centers can be so valuable. And watching that long-term untreated depression. We have many individuals these days surfacing who have had long-term mental health issues that have been unaddressed. And it's so very hard at the latter stages of life to get clarity and treatment for those concerns. No shame in asking for help along the way and getting the correct support systems that you might need. We're really fond of a safety net that we put, that we all build around ourselves and under ourselves, and how we can share that safety net and those support systems that will help us get through systems or get through life as it might be. It takes a village to bring them into the world and raise them, and it takes a village to close out this world. And so all that we can do to support one another and share support systems, both formal and informal, is really important in that successful aging journey. Really important. So let's talk a little bit about realities, fact versus fiction, and what comes to play and what doesn't come to play, and who pays for what. So typically, as we hit the age of 65, we have that opportunity to enjoy our Medicare benefits. The benefits come to us at about that age of 65, but what does Medicare really cover? It does cover Part A, Part B, that's your doctoring, your hospitalizations, and Part D, your drug systems. Nowhere in there do you hear us say that this is a housing component or a caregiving component. So understanding your Medicare benefits and making sure that they're in place and they're working to your advantage is really important. Medi-Cal is a system here that we have in California. It is a mirror image program of the National Medicaid program, but some of our dollars come from federal monies for Medi-Cal, and some of our dollars for Medi-Cal come from state monies. Medi-Cal is typically a system that is geared for low-income individuals who are fiscally frail, maybe not physically frail, but fiscally frail, and need some assistance with their Medi-Cal and their medication, their doctoring and medication benefits. And they, again, are not a housing component necessarily, nor are they an in-home care component. Medi-Cal benefits do come into play if someone is in need of medical support and cannot live at home alone. The only location that they would then be eligible to live in would be a skilled nursing facility as a Medi-Cal recipient or the assisted living waiver program. So if finances are tight and strict, you certainly would want to look into what Medi-Cal would do to benefit the long-term living arrangements of individuals. In-home care, again, this is agency or hired individual who comes in and assists you with some in-home support, as it might be bathing, dressing, grooming, mild or light housekeeping, medication reminders, etc. The bulk of the in-home care comes to us through agencies or private hires, as it might be. And this, again, is primarily paid for by out of your out of pocket. There are not a lot of programs to support in-home care other than private savings and maybe some long-term care insurance. Having a good understanding of the differential between independent living and assisted living is critical and important. Independent living is really where most of us are for the most part, either in our own homes. We may be in a senior apartment complex that's independent, but understanding what the limits are in the home in an independent capacity, and then understanding what the limits are in assisted living and what those costs might be, the differential from those two different costs, is really critical. So again, a good education in the differential between those capacities so that you can better understand where you see yourself down the road. There are also memory care settings for individuals who have cognitive issues, and those are separate entities from potentially from the independent and assisted living environments. And then there is the skilled nursing facility that offers you either long-term custodial pay, or long-term custodial stays in which Medi-Cal would be the paying source, or the rehabilitative component, which is much more short-lived, and that is where Medicare will come in for a short period of time and support that type of care, as it might be. So just a good understanding of the differentials between all of these benefits will help you make a better plan going forward as you determine where do you see yourself down the road in the scope of these different services and these different levels of care. So here's a little bit of resource reality. Where do you get those resources and what might you apply for? Because these two are really quite critical and important in the scope of things. So there is a program, if you qualify, a program called the Veterans Aid and Attendance Program. And this is a program geared at veterans who have served during a period of conflict. They only have to serve for 1 day period during that period of conflict. But based on that service that they have given our country, they may be eligible for an aid and attendance program, which is a financial boost to the assisted living or residential care facility life as it might be. It does have some income thresholds. It does have also some physical qualifications that you must meet. So it is not for everyone. It doesn't meet everyone's needs. And again, it has a tie to the veterans services and the experiences that individuals have had. We are certainly happy to guide you to specialists in this arena to help you discern whether you would be someone who would be a recipient of that program. Again, as I've mentioned, Medi-Cal may be a resource for you. It needs qualification. It has a high threshold in regards to financial indigency. And there are specialists who will assist you with the qualification for Medi-Cal as well. There is a program called In-Home Supportive Services. This is also a funding source, but again, it is geared at low-income individuals. Their goal is to keep as many people at home, remaining at home safely, but it is never intended to be a 24/7 service. So they may give you a certain number of hours per day, per month, that you can go and enlist some support at home with a caregiver. But again, typically we see an average of around 100 hours a month, which would equate to about 4 to 5 hours a day of help in the home. And furthermore, again, you have to meet fiscal criteria, and then also activities of daily living criteria. And then you may get enrolled in this program. But again, it is for a very select few, unfortunately, or fortunately for that select few, but for the rest of us, not an applicable option. And then there's long-term care insurance. If someone has been so ever so wise and has been able to acquire long-term care insurance coverage, well done you. My encouragement to you would be to make sure that you are utilizing it when it is time, not holding on to it and not getting the benefit of the long-term care insurance. And we are seeing some limitations to long-term care at this point. Individuals, or excuse me, organizations that are selling out the contract to other services and eliminating some things that you purchased at the onset, and difficulty actualizing the long-term care insurance. So very important that you have some help with making sure that you utilize your long-term care insurance in a timely fashion, as it might be. The reality is, however, the bulk of the responsibilities for housing and care as we age falls in a private pay capacity, in a savings or a retirement savings capacity. So looking at what you have aligned for yourself in those later years is going to be very important to see really how will I sustain and how will I travel through this experience, and what are my wishes, and do the two meet? And if not, where do I find that compromise? Where do I make some of the changes, as it might be? So we suggest again that you create a toolkit, you gather the resources that you need before you need them. So gather everything you can find. I think that's critical and really important, and make sure that you have that tucked away safely. Refresh it periodically, making sure everybody's still in business and still provides those resources that you're looking for, but nothing wrong with gathering them and then setting them aside for when you might need them. It's very valuable to have your home environment assessed for safety to make sure that it meets the needs as you age. So we find that really important. We're happy to do that. There are some adaptations that can be made to make the home safe and sound so that you can stay in it for as long as possible. But trying to mitigate 3 flights of stairs can be very difficult, particularly if ambulation becomes a challenge as you age. So getting a look-see at that home and understanding the costs is going to be very important, definitely. Looking at the safety, as it might be, for that home to see, can we mitigate some of these unusual circumstances? And we have lots of ideas to do it in a simple and straightforward manner. And then if that's not feasible, where do you turn to get some of those adaptations made? Again, understanding the costs, the reality of the costs. I think, again, everybody thinks, I'll just stay home. I don't want to bother anybody. But if you have to get, again, to that point where you are 24/7, that's a pretty insurmountable amount of money to sustain for a long-term period, that $20,000 to $25,000 mark. So what in reality are the costs that I can actually afford? You want to research in-home care providers. Again, last thing you want to be doing during any crisis is trying to weed through all of these issues and start to do your research and get those resources in, or those providers in your pocket. So we suggest that you look at facilities, that you contact in-home care providers, etc. Tour those settings, look at the different facilities, see what tone it is that you like and you feel your loved one would be most comfortable at. Important to do that research ahead of time. Always wise to turn to the experts. We have a huge number of experts in our community that we're happy to guide you to. From, you can see the list there, the Alzheimer's Association, Senior Legal Services, Del Oro Caregiver Resource Center, and the Area on Aging, Elder Care Management, just a plethora of resources. We're always happy to try to get that information to you. so that you can narrow down and get some of that research going. Very, very important. And again, if you're considering a senior center or an adult day healthcare or adult day program, excuse me, always good to take a peek at those. They're starting to open up again and have live opportunities. So leaving an individual at that site or on that, engaged in that process, very possible. I think that's wonderful. It's a gentle and slow open, but a great opportunity to get some activity for the individual who is the recipient, get some camaraderie, get some interaction with others, and then also for the caregiver to give them a little respite, little time to themselves to do the things that they need to do in the course of a day. So again, getting that toolkit created is an important part of this task to prepare for successful aging. I do want to just briefly address the COVID-19 issue that we're in the throes of. I know this has been very ongoing and very long-term, and I think not one of us thought it would carry on as long as it has, but it has, and it's here. So we're we feel very strongly that, we're all in a crisis. The crisis has hit already, and now these additional crises that we're having, it's simply cruel piling on, if you ask me, but COVID has presented itself with a crisis. So again, all the more reason to have these things lined up and have your materials at hand so that should the secondary crisis hit, a fractured hip, new diagnosis, a change of status, that you are ready to hit the ground running and get the changes made that will adapt and keep your loved ones safe and sound. Have the tough discussions with your decision makers. Talk this through. I don't think anybody wakes up one morning and says, oh boy, today's the day I'm going to talk about all the difficult things that I have to face as I'm aging. But let's get the conversation under our belt and then get the plan in place and get that off the table so we can continue enjoying one another during those days that we get to enjoy one another. Express your wishes, make your wishes known. Talk about what it is you want and how you want it to happen. See if it's feasible. I have no trouble telling you that your expressed wishes are going to be a tall order for you to actualize, because based on the information you've given me, it just doesn't seem viable. So again, express your wishes, make sure that everybody is aware of what it is, what your concerns might be. You want to designate an advocate, either a personal advocate or a professional advocate. You want to make sure your powers of attorney are in place, your legal documents are in place, but designating someone who can speak for you if and when you cannot is an important decision going forward. And we're finding that it's difficult to get into hospitals at times to be an advocate for a loved one. So again, having those professional documents in place and having a professional advocate may be to your advantage in the long run so that you can get wishes and wants known to those who are delivering care. Review your documents, review them periodically. A couple of weeks ago, I went out to meet with a very lovely family. We pulled out their legal documents, and lo and behold, the power of attorney and the trustee on the trust were both had passed 20 years ago. They hadn't reviewed their documents in that long time. It was time to make new documents or revise those documents. Really critical and very important to have everything up to date and shared with everyone. Doesn't mean your power of attorney is going to come in and knock you out of the way and make decisions for you, but they are going to have that opportunity to learn about what's going on for you. And then if needed, speak on your behalf if you cannot speak for yourself. And we are so, if I said this once, I'll say it a million times, make a plan B and C, make a plan A, B, and C, line everything up with alternatives, with resources, etc. Tuck it away, share what's inside that plan so that everybody can be on the same page and enjoy that experience and understand and honor you. There's nothing more uncomfortable than saying, I don't know what they want. We didn't really talk about it. It wasn't something dad wanted to discuss, wasn't something mom and dad discussed together. A very uncomfortable feel for everybody involved at that point. So again, we're in that crisis. So get your plan in place with every contingency lined up as it might be. And then there's the proverbial, we really must have a moment where we have this opportunity to talk about end of life wishes. You want to talk about your own and your loved ones. It's just time to have that discussion. First and foremost, you want to talk a little bit about what your wishes for your care is. How much treatment do you want? How much intervention? Who will be your voice? What are your ultimate terms? Etc. What are your wishes in that regard? And have you articulated them? Do you want life-sustaining treatment? Do you want mechanical intervention? Who's going to speak for you if you cannot speak for yourself? Make sure that you have a voice in this routine, and be reminded that emergency personnel, they are charged with life-sustaining efforts. And the minute they get legal and doctor ordered direction, they're going to follow that. But in the interim, they are going to do what they have been charged to do. I had a particular experience this week where a client of mine, who is a UC Davis client, and they were sent out via 911. They got to UC Davis, got en route to UC Davis, and UC Davis turned them around and said, we are full and not taking clients currently, we're not taking patients. So they had to turn around and end up at a Kaiser hospital that was able to take a patient. And now we've got two medical delivery systems again that are not necessarily connected to each other. That power of attorney became very key and critical in being the conduit to good discussion and good conversation. So again, it's really important to have all that in place as it might be. Again, understanding what hospice might look like, what palliative care services look like. It's very important to have a good understanding. Just because someone gets a hospice diagnosis doesn't mean they're eminent for this world right this minute. Typically, yes, they do have a terminal circumstance that likely has a 6-month duration. But we have seen many people graduate off of hospice. So please don't be intimidated by that word, by that title. It is really important to understand what hospice can provide and what they don't provide, who pays for hospice. It is under the Medicare umbrella. And then I think furthermore, what is palliative care? What does that look like? What does that mean? Both entities are really geared at comfort and managing the effects of a terminal diagnosis as it might be. Palliative care gives you a few more months, if not years, of lifespan. But again, a good understanding of the differential between hospice and palliative care and what each provides is really important in the end of life wishes as you discover and uncover what it is that you want as your final wishes. Have you talked about what you want in regards to burial or cremation? What types of services? Boy, we had a few clients that we lost during the height of the pandemic, and services weren't even available to anyone at that point. So again, revisiting services that you might have made arrangements for previously, checking in with the entities that might provide those services. Are they having them? What are the adaptations that they're making at this time? Prepaying for those arrangements, and just making sure family is aware, or your decision maker is aware. So again, it's a valuable, it's a tough conversation. We're happy to partner with you if it's difficult for the family to have that conversation. It should be as matter of fact as anything is in this aging experience. Emotional, sure. Without a doubt, but definitely matter of fact in many ways. And then again, there are lots of resources available that you can use. And a couple that we have listed here, the Conversation Project, 5 Wishes, Be Remembered. these are resources that help you get these conversations started, and they're just very well thought out and very, very well done. So we really encourage you to utilize the services there as well. We can connect you with those at any turn as well. Finally, I would just leave you with, everything that has a beginning has an ending. Make peace with that and all will be well. Not a one of us is getting off this planet alive. And it just depends when our time might be, but all the better. The gift that we give our loved ones is to plan in advance, to get our resources lined up, to be informed, and then to share that information, our wishes, our wants, etc., with the powers that be, so that they can take an active and comfortable spot in supporting you as you designated them to do. I think that's the important thing too. You've asked them to do this and they want to do it to the best of their abilities. So make it easy on them, if you will, and use this toolkit or use some of these guidelines to help you along the way. That's what we would wish for you as a result of this conversation that we've had. So I'm going to move it along and get Maureen back involved here. She'll assist at this point. And I just truly want to thank you all for listening today and spending some time going over things such as this. And we're always here, as it might be.